Hi, my name's Dr. Rachel Corman. I'm the Feline Medicine Specialist at Veterinary Specialist Services, and this video is just an instruction video on a treatment that we use in cats with chronic kidney disease, where we supplement them with a hormone called Darbopoletin via injections. Darbopoletin is a human analogue of a hormone that's produced by the kidneys called erythropoietin. And what happens in kidneys as they start to stop working is that they stop producing the hormone erythropoietin. That then stops telling the bone marrow that the body needs to produce new red blood cells. And over time, what happens is that the cats start to develop what we call a non-regenerative anemia. So that's where, as their red blood cells gradually die off as part of the normal aging process, they're unable to produce new red blood cells to take their place. And over time, they'll start to develop a more progressive drop in their red blood cell count. And in some patients, this can have a knock-on effect where they become more lethargic and have less energy. And this tends to happen in the later stages of kidney disease in cats. So what we do with this treatment is we're basically supplementing the cat's erythropoietin with this analogue called Darbopoletin. Now, not all cats will respond to this treatment. Approximately 60% of cats would be classified as responders, and a response is essentially an increase in their red blood cell numbers. The way that we do this treatment is that the cats initially start with weekly injections. Typically the cats would come into the clinic, either our hospital or your referring vets, and they are tested prior to each injection. So what we're looking for with that monitoring is we'll chat to you about your cat's overall health in the period since we've last seen you. We'll weigh your cat. We'll check your cat's blood pressure, and then we'll also check your cat's PCV or packed cell volume. So that's an assessment essentially of your cat's anemia and how severe the anemia is. And that will then give us information about how effective the treatment is being and whether we need to continue the dosage regime that we're currently using. To start off with, most cats will receive injections once per week, and that may continue for approximately 4 to 6 weeks until we see whether your cat is responding appropriately or not. Once your cat's PCV has increased sufficiently into the bottom end of the normal range, then we'll reduce the frequency of injections. And it might be that we get your cat back in 2 weeks or 3 weeks, depending on their response. Potential side effects from this process are possible, or from this drug are possible, and they include things such as the development of high blood pressure, which is why we check your cat's blood pressure prior to each treatment. And that's reported to occur in approximately 50% of cases. In my experience, it's probably a little less than 50%, but it's certainly a real potential complication and one that we do monitor closely for. The other potential risks are less common, but certainly still can be complications. So we can see some cats that can develop seizure activity, and in approximately 10% of cats, we can see cats that actually develop antibodies both to the hormone that we're giving, but also potentially to their own red blood cells, and they can develop a disease process called pure red cell aplasia that would require us to stop treatment at that point. Now, that's reported to occur in approximately 10% of patients, but again, our experience would be probably a lower percentage where that occurs. So bearing in mind, this is a treatment that is not without potential adverse complications, but those complications do tend to be quite mild in the majority of cases, and the potential benefits from addressing the cat's anemia can be really quite good for improving their quality of life over time. So I hope this video has been helpful for you if this is a treatment that we've recommended to you. If you have any questions, then please don't hesitate to have a look at the information on our website, or alternatively contact the clinic at any time.